How do cervical cancer types compare in aggressiveness? Cervical cancer is a complex disease with different types that behave quite differently. Understanding these differences can help us see why early detection and tailored treatment are so important. The most common type is squamous cell carcinoma, which makes up about 70 to 90% of cases. It develops slowly over many years, often starting from precancerous changes that can be caught early with regular Pap smears. When diagnosed early, the outlook for squamous cell carcinoma is generally good, with high survival rates. But if it spreads to nearby lymph nodes or organs, the prognosis worsens. Overall, it is considered less aggressive than other types. Adenocarcinoma is the second most common type, accounting for roughly 20 to 25% of cervical cancers. It originates from glandular cells higher up in the cervix that produce mucus. Compared to squamous cell carcinoma, adenocarcinoma tends to grow faster and can be more resistant to standard treatments like chemotherapy and radiation. This means it often recurs sooner and spreads more quickly. Although it is treated similarly to squamous cell carcinoma, its distinct behavior can make management more challenging. Neuroendocrine carcinomas, which include small cell and large cell types, are quite rare but are the most aggressive forms of cervical cancer. They grow very rapidly and tend to spread early, often to lymph nodes and distant organs. These tumors are classified as neuroendocrine because they originate from cells that have hormone-like features. Their prognosis is generally poor because they respond poorly to conventional treatments and requiring specialized, aggressive management. Due to their rarity, there is limited data, but they are known for their rapid progression and high likelihood of early metastasis. There are also rare variants of adenocarcinoma, such as gastric type, clear cell, and adenosquamous carcinomas. These subtypes tend to be more aggressive, with poorer responses to treatment and worse survival outcomes compared to more common types. Researchers are actively exploring molecular targets to develop better therapies for these difficult cases. Recent studies have shown that molecular and immune factors also influence how aggressive a cervical cancer can be. For example, some subtypes of squamous cell carcinoma have different immune profiles, with one subtype being more aggressive and less responsive to immune system defenses. This is especially relevant for immunocompromised individuals, such as those with HIV. Additionally, whether the cancer is caused by high-risk human papillomavirus infections also plays a role. HPV-negative cervical cancers tend to be more aggressive and have worse outcomes than HPV-positive ones, which highlights the importance of HPV status in understanding tumor behavior. In summary, the least aggressive type is squamous cell carcinoma, which grows slowly and responds well to early detection. Adenocarcinoma is more aggressive, with faster growth and treatment resistance. The most aggressive are neuroendocrine tumors, which grow rapidly and tend to spread early, leading to poorer outcomes. Recognizing these differences underscores the importance of regular screening, early diagnosis, and personalized treatment plans. Always consult healthcare professionals for individual advice, as each case can vary significantly.